Good morning, and if you're on the East Coast, good afternoon. I want to thank you all for standing by. My name is Christy Loisel. I'd like to welcome to our webinar today, Emergency Management 301, Pandemic, Caught Off Guard, and Lessons Learned. This is a first part of our emergency management series. We do have a three-part series here going on. For those of you who attend all webinars, we will provide a certificate of attendance if you do attend all three. We will have a Q&A session at the end of our call. You can submit them anytime via the Gray Questions drop-down panel. If it's hidden, go ahead and click on that red kind of orangish arrow to open it up and look for the questions section. Our presenter today is John Owen. He's a lead risk control consultant and assistant vice president for Alliant Insurance Risk Control Services team. John brings over 20 years of experience in roles of safety consulting, operations, and account management. His experience includes working for global Fortune 25 companies, startups, public organizations, as well as travel governments and casinos. He holds a Bachelor of Science in Health Science from California State University, Fresno. He is also a certified safety professional and a certified industrial hygienist. I'd now like to turn the program over to John.
Well, thank you, Christy, and welcome everyone. Good morning, good afternoon, wherever you might be joining us from. I'm glad that you're spending some time today, and certainly hope that the session and the content is thought-provoking and useful for you as well. As I was thinking about preparing for this, I realized how much all of us have been affected by the recent COVID-19 pandemic, and I think whether it's business-related or not, what we're experiencing has definitely had a much bigger impact to our lives. I know me personally, as I have 2 children that were supposed to both be away at college this fall, and I now have 2 new roommates that I wasn't anticipating. I'm sure some of you at home may have new coworkers, whether it be your children or your animals that are now coming in and spending some time with you. So as we all go through this together, I know that the experience of what's happening for all of us has had some pretty significant impacts going forward. But today, really what the goal is to kind of take a quick kind of look back. What's going on? What happened as especially the COVID came in and had an impact on the way in which the United States has been affected by this. But I want to spend also some time to really talk about preparing for potentially future infectious disease events. I know the title of the presentation didn't include that originally, but I really felt that there would be some value in just kind of laying some framework for that to give some of you who may be thinking about that some ideas. So with that in mind, as Christy said, ask questions. We'll get to the Q&A at the end. We'll do our best to answer those. And if for some reason we don't get to yours, we would follow up with you as well. My apology, 1 second, just had a technical glitch there. All right, sorry about that. So in terms of the disclaimer, like everything, we always put out a disclaimer. The information here is awareness level. We're not going to turn you into experts or maybe even cover stuff that you may or may not already know. But with all of our sessions, what we really try to do is to put out some thought-provoking, action-oriented information to make you really take a look at what's happening in your organization. And maybe there's a few nuggets that you take away that you can go take action on or maybe go investigate further that could help for the future. But at the end of the day, as the disclaimer says, really this is not meant to be a expert-level event, or are we covering anything that's going to take your responsibility away. So the goal is we're going to take a look at the factors that were involved, some of the actions to take in preparation for these events. As I mentioned, that's really what we have as the goal. Before we get started, I probably could make some assumptions here, but I thought it would be good to start with a very basic polling question. So Christy, would you mind pulling up the first polling question for me?
Absolutely. First one hopefully should launch momentarily. How prepared do you believe your organization was for a pandemic? So there's 4 options. Go ahead and select one. And if you're not sure, that's okay too. Okay, about half the votes are in. I'll give you guys a few more seconds here to think, where do we rank on this scale here? Okay, I'm going to close up the poll, so get your vote in, your selection, and I'm going to share the votes with everyone here. All right, so 11%, we were well prepared. Wow. 47%, we were partially prepared. And 42% of you, we weren't prepared, leaving 0% stating, I'm not sure. Thank you all for participating.
That's great, and I appreciate the feedback on that. And you know, I think, as always, I can certainly understand where there's a partial preparation for this. Those that felt really prepared, I'd really, it'd be interesting to see what type of business you're in. And I say that because many times, if healthcare related as an example, they tend to have these things pretty well at hand, but not always, but they tend to be better prepared. And for those of you who said we weren't prepared, again, the concept here is don't feel bad about that. At the end of the day, you're definitely not alone. I think there's a lot of organizations and clients that I work with as this has all transpired that have really taken a hard look to say, you know, wow, we hadn't anticipated this. And that's not uncommon. The real question is, and this presentation is going to focus on a little bit maybe why that was, but really what do we do going forward? Because that's the important part of this. So what happened? Boy, if you read the news, read the headlines that are on the internet, read a newspaper if you still get those, or if you watch the news, a lot of information came out and was out there about how poorly prepared as a whole the United States was for COVID and the pandemic. And it certainly was one of those, there's a lot of factors involved with this, and my presentation will not, focus on any political side of this whatsoever. But what I do want to indicate here is that there is a lot of commonality, that there are ways in which we were not prepared, both, as I'm going to share with you, all the way from the federal government all the way down to us as individuals. And I think that the key when we start to see this is to really take a step back and say, why were we caught so off guard? Because part of the learning and understanding maybe the factors that were involved help us to then look at going forward, both in our current plans, what we're doing, or maybe where we need to have improvement. It'll really help us to define that in a much deeper way. So you saw a lot of this, not a big surprise that was happening. So to that point, I try to go out and look and see, I like to share videos, because hearing me talk or my opinions are one thing, but hearing it from others in a video is important. And I found a video I want to share about the first three and a half minutes or so of this video, and I think it sets a pretty nice context for a little bit of the history behind kind of where we're at. So here we go. Hopefully it shows up.
At a pandemic simulation in October 2019, it began in healthy-looking pigs. Public health leaders gamed out the scenario.
Understand where the supplies are, broadcasting accurate information. It's really a war footing that we need to be on.
Finding massive gaps in our ability to respond.
65 million people died in the first 18 months.
There have been decades of similar warnings, urging us to prepare, ever since we failed to contain another devastating pandemic, HIV/AIDS.
We really learned a lot from HIV. So it's very difficult watching the world respond to an epidemic like COVID-19 without looking back, and the flags were going up and the warning bells were rung.
It's mysterious, it's deadly, and it's baffling medical science.
In 1981, when a terrifying new disease was reported to be killing gay men,
we were dealing with a very special, unprecedented situation.
Dr. Anthony
About that, folks.
We really have an issue here. It seems to be spreading and spreading.
According to historian Alan Brandt, the early response to HIV offers important lessons about epidemics.
The United States was extremely poorly prepared to deal with HIV disease in the earliest years. We didn't have a recent history of massive infectious epidemic diseases. We didn't have a sort of preparedness apparatus.
But that wasn't always the case.
For centuries, it has been well known that epidemic diseases follow the lines of commerce and travel. Many outbreaks of smallpox and cholera brought in by vessels.
In the late 1870s, the United States started a sophisticated quarantine and surveillance system to try to prevent deadly infections coming in from overseas.
Every precaution is taken by the quarantine officers to prevent the introduction of disease into the United States. Thousands of aliens have had to undergo an examination at the hands of the public health service. An airplane which might bring in the yellow fever mosquito, the passengers and crew are inspected for symptoms of the disease.
Tracking and treating contagious infections was an essential job for local health departments.
Cases are tracked down to prevent spread of the disease.
But in the mid-20th century, with breakthroughs like vaccines and antibiotics, infectious disease was seen as a problem of the past, and much of the quarantine system was dismantled.
An infectious disease went from a field that was right at the center of almost all medicine to really a more marginalized field. By the early 80s, when AIDS emerged, we had let our public health infrastructure deteriorate, and it was poorly funded, really poorly structured.
Federal health officials consider it an epidemic, yet you rarely hear a thing about it. Scientists do not know what caused.
Okay, I'm going to pause it at that. And again, I do apologize, folks. It had worked earlier, so I'm not sure if something had changed on my side. So I'm going to go ahead and continue on. Let me catch back up to the slides now. This is not working quite so smoothly this morning, so I apologize for that. But a couple things that I want to point out from the video that I thought was at least good from a historical perspective is that they really talked about the fact that, you know, back in the 20th century, so in the 1900s, we really saw that there was a pretty significant focus on the evaluation and the management of the potential for disease to enter into the United States, into the population. And that was done through pretty rigorous efforts with the Department of Health, as well as at the federal level through the federal programs, whether it be the National Institutes of Health, the Center for Disease Control, and others. And so with that in mind, when, as they mentioned, when really what they're indicating the last big pandemic came along in HIV or AIDS, that was really a test of the system by which you then realized that there were really some gaps because we had not managed that system by which we evaluate and try to manage pandemics from entering the United States. And so kind of what is a pandemic and where does the pandemic really come from and impact us? Obviously, first is the definition is it's something that's occurring worldwide, across international boundaries. Large number of people are involved in this. And so that's very clear with COVID and what we're dealing with now. Other examples, and what I want to point out on this slide is the interesting time gaps between the flus that we saw, especially the Spanish flu that came out in 1918, and then HIV. It's a pretty significant amount of time. And part of what was happening at that point is what the video had showed was there was some changes and kind of a feeling that, you know, we can respond well and we got this under control should there be a problem. And then we realized that maybe that wasn't exactly the case. Interestingly enough, just as a complete side note, just this week I read that here, I live in California, and in California we've had our first case of human-based plague, local, not that far from where I'm actually located at, first in 5 years. So we haven't gotten rid of all these things, but I think the management and plan for those, especially something like the plague, has happened over time. So real briefly, COVID-19, since this is really what triggered everything that's happening and really what we're focusing on here, it is a virus. The thing I'd like to emphasize with the virus that makes this a bit unique is that last bullet, that you have symptoms that range from mild to severe or asymptomatic altogether. And part of the challenge is, I think that there's a strong likelihood that we probably had COVID in the United States before we had the first symptomatic case that came in. It wouldn't be surprising that there could have been, with the amount of travel and commerce and, that goes on with the United States, that it very well could have been here before we actually found the very first symptomatic case that occurred. And that was what makes something like this so very difficult. If you don't see the symptoms, the signs, the visual clues that there's something wrong, then it's really easy to think nothing's wrong. And I think that is a little bit of the challenge with this particular novel coronavirus. Before we get into any further, what I think is important is to kind of understand where it is that the pandemic, when it comes to a pandemic, how it's evaluated and the response that then needs to align to it. So as an example, what you're looking at here is the actual, from the World Health Organization, what they identify as the phases of a pandemic. And so you can see from phases 1 to 3, they're talking about it's primarily in an animal, and from there is a few humans that do come in contact or come into infection from a particular disease. So it kind of starts to make that initial from animal to human transition. In this case, with the data that was there, the type of coronavirus that COVID-19 is, it likely was coming from an animal. I think they'd mentioned a bat in a few of the articles that I read, into contact and then transitioning from the animal to the human. So that's what's happening in phases 1 to 3. When we get to phase 4, obviously that's where you start to get sustained human transmission, meaning that it's not one person, but you're now starting to see that this is having a more sustained impact. Obviously 5 and 6 phases are where you're starting to see now the widespread infection. And we saw this early on, like with Italy, and we saw this with other countries, that it was really spreading rapidly within those countries. And even here in the United States, of course, where we've been with the phases. You get to the post-peak, and that's usually where we start to see a fact that the peak is starting to slow, but you do see reoccurring events. Sometimes those are regional or local. And then lastly, you get to the disease activity is what would be expected to be either a normal or a seasonal level, depending upon what that is. And the reason that this is important is that we have to ask ourselves, whether again it be your organization or even to our government, is what happened? Because if we're going to say why are we caught off guard, we kind of have to look at the phases of that pandemic. So if I look at phases 1 to 3, this is really where all that preparation takes place. And the preparation for what we're dealing with in the case with COVID-19 was everything you started hearing about in the news, right? Were we ready for for example, the PPE that the hospitals would need? Were we ready for and had plans in place in order to take the trigger actions to protect the individuals, our businesses, and so on? And so the preparation side of this is all what was going on, I think, initially. But the question was, how prepared were we? And I think from the video and the historical information, as well as what you now see really regularly in the media, this is probably where we had the biggest challenge. We were underprepared in a lot of ways, and it's not just at one level of government, it was across the board, as I'll kind of share with you in a minute. The next, in phase 4, when we start to see that this is sustained, meaning it's growing and it's starting to be almost to be widespread, that's where the response, your plan should be kicked in. That's where some of the trigger points come into play. And this is where, when you look at your emergency action plan as an example, that we'll talk a little bit more about in a minute, the emergency action plan has trigger points, whether it be for a fire, for example. Right now, there's several large fires not too far from me in the Napa area that are happening right now. There's a lot of smoke. So, the response side of their fire protection program and plan is probably kicked in as soon as the fire dangers elevated when we had electrical storms over the weekend. So part of it is, when you think about this, that if you can't be prepared and planned and have that response ready, by the time you get to phases 5 and 6, in some ways, all you're going to be doing is dealing with the response. And that's what we've seen the majority of from both organizations we work with, what we've seen kind of holistically within the governments, city, local, county, state, federal, is it's really been about responding. And so in the response side, the other piece that comes into play here is, how prepared were you to respond? And I think this is where the timing of our response and the timing of the impact of those responses have had potentially a larger impact to the United States. I think from a planning, there were some challenges, again, both across the United States, locally, and so on, but also in our response plan. And so we've seen even within our response plan some of the differences that have come out as it relates to local responses, are they consistent responses, and so on. What we start to see now is we've been seeing these restart activities and reopening, but we've been having to see these in the light of the current situation, meaning we're not restarting as normal, we're restarting with a lot more restrictions and changes in our work activities. And we even seeing it in everyday life. If you go to the grocery store, take a look at the shelves in the grocery store, especially for things like cleaners and disinfectants. And what you'll notice is the volumes aren't there. And there's some impacts from the resupplying of the demand that was initially impacted. So when you think about your plan, it's not just do you have the plan, it's about when you activate that plan and how prepared are you in the response activities. And if you respond quickly, you may have a better chance of addressing the impact to your organization. If your response is slow, you may have a greater impact and a longer recovery cycle to deal with that. So I kind of like the graphics because it kind of makes you think about, and you should be thinking about when you relate this to your organization, where were you at? The hardest thing that's going to come out of this, I think, for a lot of organizations is to take that real look in the mirror, so to speak, and really evaluate and say, what did we do well, but where were we really not planned or prepared for this, and how are we going to take some actions going forward? All right. So at the end of the day, this really is a shared responsibility. And I say shared because the tendency, especially if you read the the news or follow media at all, is the tendency is to try to place blame solely in one branch of government. But at the end of the day, I think that they're shared across not only the government, but businesses and even individuals. And so the thing that I want to give you an example of is, as you heard in the video, I wish you would have seen it, but as you heard in the video, we weren't really that prepared. We had kind of let our guard down because we felt we had advanced enough that we could quickly respond to these types of situations. And so everything from the way in which we were funding health departments, the way in which Congress was making funding decisions about where to put the money that we have, those decisions that have been made over years, had an impact. And I think if you look back, you could see some consistency over the last several administrations where they were indicating that concern. And so when it comes to the federal government preparation for this across, again, multiple administrations, I think there's been some decisions both at the Congress level and higher levels that have had an impact on their ability to quickly respond. I think there was some overconfidence, to be frank with you, because I think that we felt like we're, a very advanced society. We quickly have the ability to respond. And I think that overconfidence in some ways may have led to funding decisions and other things being taken. We see a real disconnect and sometimes communication that has two angles to it. One is saying one thing and one is saying another, and that creates a problem. Because when you think about a communication strategy as a whole, and again, you can use your organization, the clear, concise, and consistent that communication is will help to improve the overall direction of the organization and responding to it. If, for example, your CEO is saying one thing and you have your manager saying another, it can create confusion and some discord within the employee ranks. So I think in part we have to look at some of that from the federal government. At the state, because a lot of the true action of implementation starts to take place at both the state and local levels, what we saw was a pretty big emphasis on things like supplies. And I'll use the example again here in California. Our governor immediately went out and bought $1 billion with a B, $1 billion worth of K95 respirators for use. And the reason that was done is because we recognized, I think, that there was going to be a pretty widespread impact of this, but we weren't prepared for what the supplies we would need, especially for our first responders, might look like. So in part, what you heard a lot about is, hey, don't use N95s. Those are only for first, responders. You saw a big push on ventilators. So a lot more of it at the state level was focused around the supplies to be able to respond to the local events and activities. We've seen, depending on what state you're in, you may have seen some inconsistency in some of the both communication and the plans that are provided, where week to week you may start to see changes that have occurred. And while changes do happen and you need to respond to those changes, sometimes if they're not done right, it creates some confusion. And I raise this because the communication piece in all of this within your organization is absolutely paramount, because that is what's going to drive and set the context for a lot of the employees, the actions they take, and what occurs. So again, I think there's some shared responsibility, because I think that their federal and state were caught off guard. In the local side, the challenge on the local piece, I believe, was really they were kind of slow, and especially with information. So at the local level, when we think about things like, the cases, we think about testing, which are all going to occur usually in our local communities. There was some delay in a lot of that, and it took a while for some of this to start to show itself, where that data and information could then be utilized. And so I think, that just points out the fact that even at the local level, there was a lot of folks caught off guard. With protocols to address this have changed a little bit too over time. And again, it's okay if there's changes, but we want to make sure that those changes have some consistency to why, or with some rationale behind it. And the examples that I can give there is that, you've seen some businesses shut down locally and others not. And that's without rationale sometimes as to the why. And that's where you see some discord occur within businesses, particular businesses, and so on. At the business level, what I found in the clients I've talked to and worked with is, a lot of them were caught off guard because their emergency action plan didn't even include an infectious disease response plan. So while they were thinking about fires and earthquakes and floods and other things that are very common, the piece that they hadn't really thought about, and we'll talk more about why, was, well, what happens if it's none of those, but still has a very significant impact both to our business and our employees, such as a pandemic or an infectious disease outbreak. And so when we look at the businesses, those of you, the 11% that said we were really well prepared, I would hope it was because you had in your emergency action plan, or even a standalone, an infectious disease or response plan. And maybe that's why you feel like we were ready to go, because we already had it. But if you're one of the percentage that said we were really ready to go and you didn't have this plan, I'd be kind of curious where you felt you were ready to go. And the pieces that came into play here was everything from protocols to supplies. Many of them didn't have triggers, meaning that they just responded over time. Instead of saying, when they've seen the early news out about a particular virus that is starting to spread on a global basis, that would be a trigger point to implement their plan, or at least start to implement pieces of their plan. But again, some of the folks I talked to, understandably, they're like, we just weren't thinking we were going to have to deal with that sort of an emergency from a business and employee impact. And I think us as individuals, we were all caught off guard a bit too. I think, depending on your age, you may have had little experience. My kids have never seen anything like this. So they're pretty impacted by it. For those of you, on today's call, you may have found too that as a whole, we weren't too worried about it because there really hadn't been anything to be too worried about. And so part of it is to make sure that we recognize that we kind of have a shared role in some of this, even as individuals. And I think also that we've all had some confusing, that messaging, again, that communication and that consistency has also led to some questions and confusion on the overall perception of what's happening. So I'm throwing in all these kind of off guards because I think that understanding a little bit of where each of us play in this can lead to your organization thinking about what you might be doing going forward. So I've spoken to organizations and I kind of tried to generalize some of the feedback I heard. And again, it's only some feedback. There may be other points, but these are kind of a few that I felt were worth raising. One is when it comes to the plan. And again, the plan I'm talking about is probably your emergency response plan. If you have a epidemic or pandemic response plan or an infectious disease control plan. That's what I'm really talking about. A lot of folks just didn't have that in place. They had emergency action plan, but not for something like a pandemic. Or if they did have it, it was really limited. It didn't get into specificity of what's required, like we're now seeing a lot of organizations developing. It was untested. Hey, we had something, but we hadn't looked at it since 1989, when the HIV crisis was here, or the pandemic was here. And so part of it is it just was there, but it really hadn't been looked at or touched, and it definitely hadn't been exercised, that we'll talk more about. So when you kind of have that, the response and the ability to respond becomes pretty impacted. There was some overconfidence. Again, people were thinking as a whole, hey, we can rely on our local or federal governments or others to kind of lead the way for us, and we can be in support, but we're confident that it's all going to be taken care of well. And I think that that's a little bit of an overconfidence. And then last is some organizations said, hey, we can't plan for every single thing that might come along. And because this had a really low probability, we hadn't seen this in a long time, and we had a lot of other priorities that may have been higher, we just decided that, our plan down the road was we'll react when we need to. And that's, again, not uncommon. If that was part of where your organization might have been at, that's not surprising, because I think there's a lot that were kind of in that boat too. And so these are just general examples of some of the reasons that I was hearing about from some of the clients. Christy, I'd like to open up poll number 2, if we could, please.
Okay, I've just launched number 2. What is the primary reason you believe your organization was caught off guard? So just select one. There are 5 choices there. Give you guys a few seconds to respond. Okay, I've got about close to 60% of the votes in. I'll give you guys a few more seconds, and then we'll wrap up the polling and share the results. Okay, I'm going to close up the polling, so get your last second selection in, and I'll share the responses here. All right, 22% of you did not have a plan or stated it was because you did not have a plan. 0%, plan was not effective. 67% of you did not anticipate a pandemic, so not prepared naturally. 8% were not caught off guard, very good for you. 2% were not sure. So again, thank you all for participating.
Yeah, thank you for that, and I appreciate the feedback. For those of you in the largest category, again, that is the more common. To be very frank with you, those that were in that 8% group, again, I anticipate there's probably some organizations, and again, I'll use the healthcare as an example, that tend to have that. If you weren't in that, then hey, congratulations, that's great. It sounds like you really had thought this through really well in terms of the impact. But for the rest of you, whether you didn't have a plan or it was limited, or you just weren't anticipating this, I guess I would say welcome to the club. I think there's a lot of us that were probably in the same situation, other businesses. So, well, let's switch gears a little bit. And what I want to do is put out some ideas, suggestions to you as it relates to, let's take a step back now and start thinking about, well, if this can happen once, it can certainly happen again. And so what maybe are some of the things we should think about doing in preparation for the next event that could occur? And the one thing that I would keep in mind here is that the event could be a pandemic like we're dealing with now, but it may not be. It could be that you have, and I'll use an example, maybe there's an outbreak of measles or mumps, something that we don't see that often that occurs in your local community. Those could be other reasons why you would trigger a plan as it relates to response. So a lot of this will be focused around a higher level, but keep that in mind as we go through this. So very simply put, it has to start with an evaluation. And the evaluation to me is really about what I mentioned earlier. You got to take a step back, and you got to take a hard look in the mirror, and you got to get some input from managers and even line employees. Don't forget them, because they have the experience as well about their perspective on what occurred. But you need to go through and you need to evaluate your current plan, if you have one. And if you don't, clearly that's the first step, starting point. But if you do, you need to take a look at what exactly worked and what didn't work and why, and where are those gaps? What is it that if we did this, we would have had a lessened impact from the results of this pandemic? And so, you know, when you evaluate this, that's probably the most important piece as you start, because if you really do a true evaluation and get detailed with the where the gaps were, what we did right, then you're going to take that into your plan, and you're going to start to address those gaps. And so the model, whether it be the plan, do, check, act, some people might be familiar with the Sigma 6 or other that you have out there, the different methodologies. Whatever you use, it should all have the same consistency. You're evaluating, you're making the improvements, you're implementing those improvements, you're verifying those improvements, and then you're measuring and responding to a regular review and taking action on those. So however that method is that you currently use in your organization, this should be a part of that natural process. If you don't have a process, then you definitely want to have that one put into place. So I'm going to walk you through a little bit of just some thoughts on each of those general steps. So evaluation. And at the end of the day, when we really start evaluation, as I mentioned before, it's as a whole, how did the organization respond? But you may even have department-specific input, and this is where department managers can get input from their employees. Hey, what worked, what didn't, what was clear, what wasn't clear, and collect that so you can look at it both at a rolled-up level at the organization, but there may even be departments and/or location-specific response information. But as a whole, what we really are talking about doing here is opening up that program. Again, use the example of the emergency action plan or your infectious disease control plan if you have one, and going through what the response was. How did the organization respond? Even if you had it in place and you felt you had all the details outlined, how did people respond, and was the response what was expected and the outcome what was expected? At the end of the day, what were we ready for and what were we not ready for? Be specific, and you really should break this through in kind of the major sections and categories of your plan. Roles and responsibilities or accountabilities. Did people do what they were supposed to do the way they were supposed to do it in the time frame that they were supposed to do it, and was it confirmed and done, as an example? The trigger points is a really fun one, because at the end of the day, what are the trigger points? Were there trigger points defined? And again, I use the term trigger points because what I'm talking about is those indicators that there's something on the horizon, and at what point does it trigger your program, and what part of your program is triggered? Because what I found is that if you look back at kind of the federal, state, local, is that by the time the triggers were put in place, they're playing catch up on the response. And look at everything from the operational aspect to things such as, your supplies. Were you prepared for a modified operation? So I'll use an example. I've had a lot of clients that have come back and said, hey, we have people working from home now, and we weren't anticipating this, and so we're looking for resources and assistance from us, which we provide. But, were they really thinking they were ever going to have employees working mostly remotely? And that has a pretty significant impact. So that would be an example of some of the review activities, as well as the procedures. A lot of us now have written procedures that have come into play and say, when you're coming into the office, like I came into my office today, we have very specific protocols. We have approvals to go through. Obviously, if I'm outside of my office, I'm in a mask. We have disinfection protocols to take place. So all those things were put into place. And I think as a result of that, for the next scenario that could come along, infectious disease, we've got a lot of those kind of now in place. But before that, a lot of that was not in place. Identifying the gaps and improvement. So at the end of the day, when you're looking at the gaps, you're also going to have to use some strategies around prioritization of the improvement. Some of those might be straightforward, others might take time and resources to put in place. You're likely going to have to do some prioritization depending on the type and the volume of gaps that you actually get. But the objective is pretty simple, is, where did we have a gap? And it was either a gap because it didn't exist, or it could be a gap and then it wasn't implemented correctly, as an example. And so you're looking for those to make the continuous improvement of your emergency action plan or your infectious disease control plan, and make sure that you're in sync with going through that. At the end of the day, what we really want to understand is not just what went wrong, but if we did things right, if there were things that went right, talk those through, get the input as to why they went right. Make sure that we're clear on that, because we want to continue those going forward, is they're applicable to the next scenario. I think where a lot of people indicated that they were caught off guard, I think what it really boils down to is when people go through the what-if scenarios for their emergency action plan, it's not uncommon to think, again, fire, water, those that are the higher probability of potential based on your location and your environment. The what-if scenarios, I can almost guarantee you for everybody now, are going to include the pandemic component to this, the biological or infectious disease aspect. So when you think through some of your scenarios, don't try not to limit yourself with just those that you think are the most probable. List out those that might be very low probability, but at least you have an idea of where you want to, put your effort into improvement of those types of scenarios. But take a look, especially at the scenarios that you have used. And for those of you that said, we were partially prepared or we were pretty well prepared, I hopefully would mean you had those scenarios already planned for. Plan the before. And what I mean by that is that if you're really going to be involved in the execution and the response, that means you've got to plan the before it happens. Because again, that means your response to it is going to be, is hopefully going to have limited delay. And so the plan the before all this gets implemented and takes place and you trigger your plan means that, and we'll talk more about it in a minute, means that you really have gotten in and understood the preparation and the readiness. So the word I would use is the readiness of your organization to be able to implement, respond, and correctly address your plan. Go through the documentation, complete the improvements, all those things that should be standard as a part of any of your continuous improvement cycles, whether it be for this particular program and issue or maybe other parts of and aspects of your business. So those are just, again, a couple stepping points. But at the end of the day, where I do believe those that may have said, hey, we had it partially in place, but maybe not entirely, I have a feeling, and I'm just making a guess here, that you may have had some of the structural components in your plan, but perhaps you also had not tested those. Because the piece about testing or doing a drill, for example, like a tabletop drill, they typically do this, and you see this in incident command. So I'll use an example, like, again, we've got all the fires going on near us, and there's multiple fires happening. And these are large fires. So you've got a whole incident command structure that's in place. But during the off season, the non-fire season, they're doing drills. They're looking back at what worked, what didn't work, right? How could we respond differently that may have impacted the intensity or the overall impact of these wildfires? They're going through drills. That's a part of what they do to try to look for areas of improved response, but also this is really about that practice piece. So you're practicing to see, do we have a gap? Maybe we didn't even realize that we had a gap in our plan because we thought we had it all laid out, but when we practice it, the gap becomes glaring. They practice because they want to confirm the controls. So in the case of, an infectious disease, we're going to talk about controls in a second, but they practice because as a part of that practice, they're looking at what controls they're putting in place to protect their business, their operations, their employees. And they're also practicing to improve their response. And as I mentioned before, one of the biggest values is improved response time can have a dramatic impact on the overall impact of the event to their business. So, if you're not doing this, it'd be really important not to forget it, because the tendency is we've got a program, it's documented, it's thorough, and we're in great shape. And the answer is on paper you are, but not in practice until you actually confirm it. I always like to throw in this slide because I do think it's very important to recognize when you're thinking through your plan, you have to think about the controls. And these is what's called the hierarchy of controls. And so at the end of the day, when it comes to the pandemic, can you remove the pandemic? Well, likely not, right? Not initially you can't. Can you replace it with something less of a pandemic? Probably not. But we can do things, and you have seen most organizations put in place engineering controls, administration, or even PPE. And the PPE focus that's really been out there is all the face coverings, right? So face coverings, if you're in a workplace, it's the respiratory protection and so on. But we're starting to see a lot more of the administrative that's a part of the plans, and this would be the disinfection protocols, the training of your employees, the procedures. And engineering controls we probably all see on a regular basis now. If you go to the grocery store, there's the plexiglass shield between you and the cashier. So that's an example of where we're seeing engineering controls or barriers to isolate people away from it. So as you think about your plan, don't forget you usually are going to have multiple hierarchy of controls. If you're relying on PPE, you're using the least effective method with the highest potential for a problem. And lastly, the step is review and evaluate. And at regular intervals, manage the participation, get the participation from management, because this has to be something that's not just supported, but implemented. Look at those changes. At the end of the day, the changes can take place from what's changed in your operation. It could be what's changing in the world we live in. But you really want to look at organization and outside the organization impacts to your plan and what that might mean, which means you're going to have to regularly review your plan. Typically, it's an annual basis, but you may need to do it more frequently if there are changes that take place. So probably a lot of you might be going back and starting to do that review here in the near term because of the fact that COVID came out and that was something new that we hadn't necessarily had as much preparation for. And again, once you're done with this, you can kind of go back to step 3 and do the training. And this is a continual cycle of effort that you're going to take. When it comes to the gaps, a lot of the clients had indicated in feedback to me is, you know, as I mentioned before, there was the trigger piece. So we really didn't recognize we needed to trigger our plan, even if we had it. And that's assuming they had it, but they may not even have the plan. Responsibilities weren't clear. We didn't have the supplies. People weren't trained. We didn't have procedures for responding. We kind of had to create those as we went. And ultimately, we also didn't have a lot of business continuity or recovery. So if you have a business continuity recovery plan, you know, where does this fit in support of that? Because the business is going to be impacted in the recovery. Examples of that might be, you know, my tribal nations I work with and others have had this. So no, I'm throwing out a lot of ideas for you. And again, the concept here is to get you thinking. If you're feeling like we got a pretty good response on this, great. If not, this might be taking you back to some ideas. I want to take a couple minutes here and just focus on infectious disease. One of the documents you see in your handouts is just a general strategy around this that kind of summarizes about a bit of what I'm going to refer you to here. But at the end of the day, when it comes to infectious disease planning, the basics are, you know, like everything, it's before the event. And you can see here that it's all about the training, HR policies like furlough that maybe some of you have been impacted by, your communication plan. Are you currently coordinated well with your local health officials? And I would say a lot more people are now than they were in the past. Do you have a committee? Because there may even be a need for an infectious disease committee within your organization who really looks at and plans for that what-if scenario of an infectious disease, whether it be from a pandemic or whether it be also from something local, again, that's more localized in your area. But make sure when you think about the infectious disease component to this, that you really, you know, get involved in thinking about some of the basics. Christy, would you go ahead and throw up poll number 3 for me, please?
Yes, I have launched. It may take a second for you guys to view it. It asks, does your organization have an effective review and evaluation strategy for your emergency action plan or similar plan? I'll give you guys a few seconds here to respond. Okay, slowly trickling in. Okay, I've got about 60%. I was hoping to get a little bit more. Some of you may not know, that's okay too. All right, I'm going to close up the responses and share with everyone now. All right, 23% said yes, we have a process of regular review and evaluation. 40%, sort of. We review, but not regular or formal. And 30%, no, we do not have a formal process. 8%, we're not sure. Again, thanks for sharing your responses.
Yeah, thank you very much. And again, if you're not doing this, this probably is going to be one of the biggest suggestions as a takeaway for you is that needs to be done. And I expect that as the dust kind of settles from the impact to your organization, that there's probably going to be a new and increased importance in doing that. So don't be surprised. But for those of you that kind of do but not formal, or those of you that don't, you definitely are going to want to think that through. Otherwise, you will probably put yourself in more of a responding and having a little impact on the ability to, you know, have something impact your organization. All right, a few more slides and we'll get to Q&A. During the event, again, I think a lot of us recognize this, but, you know, make sure you're implementing your plan. if you have it. You might find that you're making adjustments to your plan as you go, and that's okay, because you can't anticipate necessarily every single thing that can happen. But as a whole, that plan should be covering the majority. Make sure you evaluate the controls. Just because you put them in place originally, are they working? Or, for example, if there is requirements for people coming into the office, like our office, and there are very specific protocols you have to follow, are they being followed? And if the answer is no, then that needs to be addressed before it becomes a problem. Frequent communication and clear, we've kind of gone through the communication. I want to hammer away on that. But there also may be, what is going to be the impact of my operations during the event? Obviously, a lot of us have had that impact, right? We're working from home. We might be doing, rotational schedule in our workplace. Might not be traveling because of travel restrictions. So don't forget those things. Another during the event that I'm going to highlight, because I've seen some of this recently, is water intrusion issues. Because there's no one in the building, and now you've got water leaks or something else that occurs, and now you've got a major water problem. So don't forget that, if you have unoccupied buildings, don't forget to inspect those, because we have seen a few more of those events since this really took a hold here in the workplaces with people working from home. And lastly is, now we've kind of dealt with the before, during, and now we're talking about the recovery side of this. And so, a lot of it is the federal, state, local are going to dictate what people can and can't do with recovery and when they can do it. So of course, follow all that. But you really want to maybe take a next step and look at your organization in terms of the risk groups. So in this case, if you have risk groups that are a higher risk, you may have a different plan for their restarting or being back in the office than you might have for others. That would be an example. And because of that, you might phase in people over time. Make sure you do that pre-inspection of the buildings, as I mentioned, because there's going to be fire systems, water systems, life safety systems that would need to be checked and insured. HVAC impacts may come into play, especially with concerns over the airborne nature of COVID, as an example. And then screening processes and procedures and so on. So the recovery side of this is going to be probably phased over time and is going to incorporate in multiple steps, but be prepared to go from the recovery, maybe even taking a step back and then going back forward, because we've seen that. We've seen businesses open and then you close back down. So as you think this plan through and you're looking at your recovery, kind of be prepared for both the operational aspects of recovery, but what to do in the event that you have to, go back into more of the during event again. All right, so make sure that you think this through, because the tendency I've found is that perception and reality can be a bit different. We think we're doing great, everything's fantastic, but you really will know it when you're tested. So those of you that have been significantly tested and the perception is still great, the results have been great, fantastic. For those of you that maybe thought we were in great shape and then you've been tested and it's like, wow, I guess we weren't as ready as we thought. Number one, don't feel bad about that, because that is more common than not. But make sure when you think this through that you really are prepared, you have the organization prepared. The executive team has to be 100% behind this. If they are not, then the communication and the dependence on following the plan become a question mark. Make sure that there is accountability within the organization to follow the plan, and that people are adequately trained and communicated around what the actions and plans would be. So these are just some thoughts to throw out. I hope you've jotted down a couple things to go back and discuss either with your colleagues or actions maybe that you could be taking, or maybe even feeling like you're doing pretty well. We do have a number of resources, just to point this out to you, for the Alliant clients. We've got a website here. You can see the address, where we do have a number of different types of checklists and fact sheets to try to help. We started putting these together in the April timeframe, so we try to get as much of the current information at that time as possible. There may be some changes in information, but the concept of the checklist is just to maybe give you a thought-provoking list of items. Oh, we thought about these things, great. Oh, we hadn't thought about that. That's a good point. That's what the checklists were designed for. And then for any tribal accounts that might be on the call, we have the same thing on the tribalfirst.com website that you can take a look at as well. As always, if you have any questions or concerns, or you need to reach out to us, riskcontrol@alliant.com is how you can get a hold of us. So with that, Christy, I'm going to take a break. We do have a few minutes left, so I want to see if we had any questions I could try to answer.
We do have a few questions that came in. First question being, does Alliant have any general COVID-19 employee training available?
Actually, we do. That's a great question because we recognize a number of things. We quickly try to get resources for working from home, so some general working from home setup guides for folks because we recognized that was something that was happening pretty quickly. We also did back in May, we did a few sessions of a COVID awareness training, and it was specifically for employees. General training, what it is, symptoms, signs, and then some general suggestions for approaches to take as you look at your workplace and what's happening. So to get to those, really, I think we could probably, I believe, Christine, you can keep me honest. I think there's probably some of these that might be linked off of this website.
I can't say for certain. The bottom part is a little cut off.
Cut off,
if you do want that, I did send it on the chat panel, the link for the Alliant branded one. I can grab the Tribal First one as well and send it out. If you can't get to it or it's not showing up for you, let me know. I'm happy to email you these links. They are general Tribal branded and Alliant branded products that are very general in nature. They're just giving you, John, I think you presented on many of these, so did Mark.
Yeah.
And they're general just to give you an awareness of what the exposure is and how you can kind of do preventative measures to protect yourself. But it's not obviously going to be specific to your organization, granted.
Right.
So hopefully that helps.
We did put a little bit of information in, for example, for tribes with their hotel casinos as an example. So.
Okay, so if my organization has additional questions about infectious disease control planning, can we contact Alliant Risk Control?
The answer is, of course. We're happy to do what we can to help you. We do have some resources, as I mentioned, that are out there, but everyone's circumstance might be slightly different. I know here in California that there was a input from OSHA, from Cal OSHA, about adding in a COVID-19 plan to your illness and injury prevention plan. So there's things like that that we've worked on with clients as well. So if you have questions outside of that, or you're looking for resources, or just want to have someone ask a question with, that's why we're here. And again, the best way is just through that riskcontrol@alliant.com, and we'll get right back to you.
Okay, last question so far. How soon, once COVID-19 subsides, should we review our EAP?
Ooh, that's a tricky question. And I'll say that because I have a feeling COVID's going to stick around longer than any of us thought. And I think many of us may have thought it was already going to be gone by now, or at least addressed. So I really would not suggest that you wait until there's the quote, all clear sign, if there is such a thing, before you go back and look at your EAP. What I do think that you will want to do probably is, depending on each organization and where you're at with responding, is when you feel you've got your response to the current situation in a good, manageable, managed well right now, or as well as you can, that might be the time to start planning for taking a look at your EAP and going through that evaluation cycle. Start the evaluation cycle. You don't have to wait for, COVID to quote go away or be seasonal or move into the later phase that we saw on the WHO pandemic phases. So again, I wouldn't wait until it's the all clear sign. I think it really is organization dependent, and I think that your organization will need to make that step once you've got the current scenario managed well, before you can turn and start to evaluate what's happened and make changes in your plan.
Okay, thank you, John. I don't see any further questions that have come in. I want to remind you, if you were unable to access any of the handouts, please be sure to email us at riskcontrol@alliant.com. Happy to send this to you and any links you may need to training sessions that were done either in any time between March and through July. Happy to send this to you. I do want to remind you our next webinar in this series is September 9th. In our Emergency Management 301, it is Fundamentals of Emergency Management. And yes, there will be some correlation to COVID-19 in there. It's focusing more on restoring order. Chuck Stewart will be presenting that. And again, that's September 9th. The announcement will go out in a couple weeks. Thank you, John, for an excellent presentation. And thank you all for attending today. We always appreciate your input during our presentations and your thoughtful questions. Thank you, and we hope to see you at our next webinar in September.
Thanks, everyone. Have a great rest of your day.